Hey, this is Russ. I had a question come up from one of my viewers. His name is Robert, and he kind of brought up some things that I had already thought about doing. So I figure I'm going to answer his questions and cover what I was going to talk about anyways, all in one shot. Okay? So here, let me read the question he had sent to me via comments. He says, Russ, what explanation is your doctor giving for what is happening to you? Is this what he expected and discussed with you prior to surgery? If I knew that my outcome would be the same as yours, I would not even consider going ahead with my TKR. My doctor tells me 10 to 14 days with a walker, 6 weeks with a cane, and return to work at a very physical job in 10 to 12 weeks. It really sounds optimistic compared to what you've experienced. Seems you are still not satisfied with your results, and that's what concerns me. How do you not get depressed? Okay, let's answer some of these. Let me go with the first question. His first question again. Let's read that top part section again. What explanation is your doctor giving for what is happening to you? Is this what is expected and discussed with you prior to surgery? Okay, so there's really no explanation that the doctor's given to me, and quite frankly, I've never really asked him to tell you the truth. Let me say this. Many people have said to me that, what did the doctor do wrong? And it's my opinion that the doctor didn't do anything wrong. Quite frankly, I think the surgery actually went well as far as the surgical part of it, although my reaction is not that great to it. All right, it's taken me a lot longer to bring myself back to a usable level. Let's put it that way. And so I don't really blame the doctor for that. I think it's really my own body not healing the way it should heal. But as far as the knee itself, everything was put in properly. The scar looks good. There's some darkening. We've talked about this before on the scars, like blood underneath it that seems to not want to go away. But it's not bumpy. I've seen some very bad looking scars in my time, and it doesn't look like that. So on the level of the surgery part of it, I don't think he did anything wrong. And also the implant is not too big or too small. I think it actually is probably the proper size. So he did discuss with me some expectations. He said that really in about 2 months you should be able to go back to doing the things that you normally were doing. Now, obviously that never happened. Okay. And although I have not had as many doctor appointments as I have compared to physical therapy appointments, I think he knows, and I know that my physical therapist knows because I've told him before that I really don't want to see my doctor. It's not like I don't want to see him. It's that every time I go to see him, I have to pay a copay of about $70. And usually the appointments are just for me to tell him the exact same things that the physical therapist is going to put in his reports anyways. So I've told my physical therapist, I don't want to see the doctor. I just want to finish my stuff. And as long as there's no problems happening with my knee that's beyond, what I can do, then I'll go see him. And I think my doctor knew that as well, because I don't know if I've ever told the doctor, but I think I told him once that says you cost me too much money every time I see you, so I don't want to see you. And so my physical therapist has when I was going to see them, his office is essentially next to my doctor's office, so he will just run over there and say, hey, Russ came in, he's doing 120. Hey, Russ has hit 130. He's told my doctor this. So we've indirectly communicated through my physical therapist to save myself $70 for an appointment, okay? Now, I know my wife isn't happy with that. She says that, you should have more interaction with your doctor and he should follow up with you. But I've told her the same thing, that every time I go to see this guy, it's going to cost me money. So I really don't want to have any interaction with him. I said, I'll interact with him once I'm in the operating room again, okay? And that'll be when the right knee happens. So, his expectations was 2 months to be back to normal. And obviously, we're not at that level now. The only other things that we've talked about is when I was in the I've had some follow up visits way in the beginning, And that's when we made decisions for doing the MUA and doing a second MUA. But after the second MUA, I really haven't had that much interaction with him. I had to go in a couple of times for x-rays, and I think they typically do this just to make sure everything seems like it's fitting well. And each time I've gone in, everything looked good. So he can't really do a whole lot for me beyond that. It's really up to the physical therapist or my own work to get myself to bend and extend properly and to walk properly. So yeah, that's the only interaction I've had with a doctor since. Okay, so here's his other one. He says, it really sounds like you're not satisfied with the results, and that's what concerns me. Okay, so let me address that question. Okay, it's not like I'm not satisfied with my results. I'm just, I guess I'm just surprised, like everybody else, that it's taken so long to get to those results. Right? It's been 18 months now, and if you look strictly on my flexion and my extension, I'm doing okay, actually. I'm at 120 degrees of flexion, and that's not from the physical therapist pushing me to get that number. That's from me just kind of leaning forward when I'm sitting on the recumbent bike and bending my knee. So really, could I go past 120? If you measure how physical therapists push hard on you, I'm probably past 120. This is what I can do for 120, and I would say that's respectable. Okay, is it the best? No, I've seen people with a lot greater flexion, but I'm functional at 120. And as far as my extension, I'm going to do a video soon about why I believe my extension was never as good as it should have been, and I have a theory behind that, and I think there's probably a lot of things that people would say, yeah, that theory is probably correct. Why your extension's not so good. So that video is coming up. So stay tuned for that one. But the extension went from 0 degrees at the MUA twice, but after I got out of the MUA, I was at 20 degrees. Okay, so not good. And then working on it myself, because the physical therapist really didn't do that much on extension exercises for me. He kind of relied on me doing it. I brought myself down to 10 degrees, and then when the jazz unit came back to me, I brought that down to 8 degrees. And after a couple of weeks of rest after I gave back the jazz, I found that it actually went down to 5. So I think it was probably the stressing of the knee for months on the jazz. When it had a chance to kind of relax, it actually went down further. So, and that's of course attributed to the jazz unit because it helped me get there. So I measured up at 5 degrees, and I believe today I'm actually lower than 5 degrees. I just haven't measured it yet. This is the one measurement that I don't really feel I can measure properly myself. I really need someone to really look at that. And I know you guys probably wonder why my wife doesn't do it, but really she's sick and tired of my talking about the knee, so I don't ask her to do it. But I feel I'm past 5 degrees now. I think I'm probably, if I had to guess, maybe another couple of degrees more. So let's say between 0 and 5, all right? Because we know it's not 0, but I kind of know it's not 5 either. I think it's actually lower, all right? So if you look at that in terms of results, I'm actually not dissatisfied. I'm actually there. It's just I'm dissatisfied maybe with how long it's taken, okay? Now, keep in mind, too, I don't have really any pain other than my left knee clicks a little bit now. And when I'm talking about clicking, it's like if I extend it, I'll hear it. When I bend it back, I'll hear. Okay, so I'm not talking one click. I'm talking kind of like a crunching sound. And others have said that this it was brought up to their doctors, and the doctors have told them that that's kind of normal. So yeah, I mean, that part of it just started happening within the last month and something, maybe 2 months, I don't know, something like that. So I'm not that concerned with it because I know others have said that their doctors have told them not to worry too much about it. It's just the way it's going to be, okay? And it's not like it hurts or anything like that. It's just that, it doesn't move smoothly, okay? It kind of has a little click, 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 Okay, last one. How do you not get depressed? Okay. Well, I actually was depressed, right? And I think I mentioned that before. Going through the knee replacement in the earliest stages of this thing, I was depressed, and I was told that from a family member that you're not depressed, you're just sad. Well, isn't that kind of depressed? And I think that eventually went away. I think eventually I accepted where my situation was and that I had to work on it. And yeah, I get sad every now and then that my knee is not good. I'm sad that I can't do things. I'll admit that I'm not happy about the whole thing. Let's put it that way. But I'm not depressed about it. Okay. If you focus only on the depression part of it and the sadness of the fact that you can't do certain things anymore that maybe you were able to do before you had this whole knee replacement stuff, then yeah, you're gonna not gonna be a happy person. So I'd rather focus on the fact that I'm glad I can still walk. Let's put it like that. Okay. I mean, it could be worse where I can't walk at all. So I look at it as, I accept what I've been given and what I'm dealing with. Okay. And I hope that you guys feel the same way too, that if you're not doing as good as you can, that you keep working at it, and then that you eventually accept where you are. Because without that acceptance, you're not going to be a happy person, and that's not going to be good for anybody, you yourself or even your family around you. So accept where you are, and then work hard to try to get out of that, right? And that's what I continue to do. Now, admittedly, I don't do everything that I should do. I tell you guys to go and do exercises, and I don't do it, right? I don't do as much of the exercises that I tell you should be doing, but I know that you need to do it, and that's just laziness on my part. So as far as like the flexion exercises and extension exercises, those things I don't stop. I continue to do that constantly. So those exercises I do. But things like working on stamina or things that stay on the recumbent bike for 15 minutes, I don't do that, right? And I know I need to do that. So that's laziness on my part, and I know I need to go back to do that. Now, interestingly, I did take a blood pressure reading lately, and it's higher than it should be. So that's from inactivity. So I know that if I do some more active things, I can lower that blood pressure a little bit. So yeah, I choose not to be depressed about it, but I understand what I need to do, even though I don't do it. So, okay, I think that we've beat that over to death at this point. So, I just want you guys to know that I'm happy where I'm at. I'm sad that it took so long to get there. I'm not perfect. I'm still working at it. All right. Well, let's look at it this way. It gives me ways to keep talking to you guys because I'm still dealing with my knee too. If my knee was perfect, I would not know what to say to you guys anymore. But no, it's not perfect, and it's been a year and a half. So, but it is getting better. I would say it's constantly getting a little better, a little better. It's just slow, okay? And yeah, I would say if I had a regular job to go back to and couldn't function, I would probably be a lot more sad about that, okay? But because of the pandemic and situations as it is, I'm not doing a whole lot other than making these YouTube videos for you guys. So that's all I got to do. Anyways, I will talk to you guys next time and hit that like and subscribe button. Okay. Talk to you guys next time. Bye.